Welcome everyone. Give everybody a few minutes to get connected and get settled, then we'll get started. All right. While we're waiting, I see a few people still joining. I'm going to get us started with a mindfulness activity. So you can keep your camera on, you can turn your camera off, whatever is most comfortable for you. But I would ask that you first focus on letting your eyes kind of get comfortable at a comfortable gaze or close them. Pay attention to your posture and sort of your breathing pathway. And take 2 or 3 deep breaths, trying to breathe out a little longer than you're breathing in. And then we're going to focus on some of our senses. So first, going to bring your attention to your sense of smell. As you take a few deep breaths in, pay attention to maybe the moisture in the air, any scents. And then bring your attention to your sense of touch. Where are your feet touching? Do you notice any pressure? What are your hands touching? And then wherever you are, find a nice color, something that draws your attention, or maybe something you're being very intentional about focusing on. As you do that, just pay attention to any bodily sensations, any emotions that might be coming up for you. And whenever you're ready, with intention, bring your attention back to the group. Turn your camera on whenever you're ready. Thanks, everybody. And so with that, I'm going to pass it to Lauren. All right. Thanks, everyone.
All right. Welcome, everyone. Happy New Year, if that's still okay to say. I know there's debate in my household, and we haven't seen each other in 2024, so I will go with it. Today, we are going to have Dr. Lindsey Bruett. She is a psychologist and associate clinical professor of psychiatry and behavioral sciences at the University of California, San Francisco. Talk to us about thoughts, feelings, behaviors, and how they're connected and what we can do to help. And when we have patients or students or families in the moment that we feel like can really benefit from thinking through this connection. So Dr. Bruett provides clinical care and supervision in eating disorders, anxiety, depression, trauma, OCD, suicide and self-harm, gender diversity, and behavioral parent training. She leads the eating disorder program at Zuckerberg San Francisco General Hospital and is the adolescent mental health training lead at the General Hospital and associate program director for the UCSF Child and Adolescent Psychiatry Fellowship Program. So with this, I will turn it over to Dr. Bruett.
Thanks so much, Lauren and Evan. I'm glad to be with you all today. See if my slides will want to advance. All right. So no particular financial disclosures. This is information about our funding sources at CAP. We are going to be talking about thoughts, feelings, and behaviors, how they're connected, and we're going to get sort of concrete with ways that you can both share this information with the young people you work with and also develop strategies that you can use to also help the young people that you work with. Okay, so many folks will probably be familiar, at least with the term cognitive behavioral therapy, or CBT, which is an evidence-based strategy originally developed for adult depression that's been adapted for use with many, many, many presenting problems, anxiety, depression. I could go on and on and on, but it has shown to be effective for many of the things that the young people that we work with struggle with. And one of the core principles of CBT is what we call the CBT triangle. And this shows us that our thoughts, feelings, which we would call our emotions, and physical sensations in our body, which are sometimes the same thing, but sometimes not. So like butterflies in the tummy, racing heart, things like that might give me a cue that I'm anxious or I'm angry, for example. And then behaviors. And behavior would mean anything that we can stop doing or start doing, kind of anything that we can change. It's not always like an overt action. And some folks, Pamela Hayes in particular is a psychologist that I like to follow her, and she adds environment in as an influence with the CBT triangle. So we'll talk more about what that means in a moment. And to note here that all of these things are influenced by culture. So the way I experience my thoughts, the thoughts that I have are influenced by the experiences that I've had growing up and as an adult. The way that I interpret physical feelings in my body, or even how tuned in I am to physical feelings in my body, as well as how I might behave in response to those feelings, are influenced again kind of by the influences that I've had throughout my life. And of course, environment is influenced by culture. We all live in culture of cultures. So I want to take us through an example to illustrate this a little bit better here. And I need to move my Zoom controls so I can see. There we go. Okay, so take a situation, thinking about the school setting, taking a situation of a student, let's say fourth grader, about to have a math test later today on Thursday, and they're having the thought, I'm going to fail this math test. Feelings that might go along with that, at least when I was an anxious third or fourth grader, might have been feeling worried, feeling anxiety, feeling butterflies in the tummy, changes in heart rate, feeling flushed, feeling kind of hot, maybe feeling sweaty hands, things like that. Behaviorally, young people might engage in any sort of behavior, but examples might be asking their caregiver if they can stay home from school, asking to go to the nurse's office, maybe being extra quiet in the classroom, or on the contrary, acting out in the classroom. We know that both of those things can be responses to anxiety. When we zoom out and think about the environment, this includes, for most kids, both the home and school environment, as well as other contexts that they may find themselves in. So what's the classroom setting like? Is it a calm classroom? Is it a chaotic classroom? What's going on that particular day? What's kind of the tenor of the room? Their social relationships, is their friend in class that day and sitting next to them, or are they feeling lonely in class that day or that year in school? Do they have a caregiver at home who was able to help them study for this test, or is that not available to them? Thinking about other kind of broad resilience factors and stressors, how does their family talk about school achievement? Do they focus on kind of effort versus outcome? What's that like in terms of pressure or not? And then how are they doing physically that day? Are they hungry? Are they tired? Are they not feeling well? We know that if any of those things are true, it's going to be harder to feel resilient in the face of a stressor like a test. So what is even the point of having emotions? And I'll actually go back for a second. I'll ask folks to put in the chat, what do you think are reasons why we have emotions as humans, or why theorists think that we have emotions? What purpose do they serve? Coping with situations, to protect us, motivate us at times. Absolutely. I agree with all those things. Please keep adding ideas if you have them. Um, so yes, we could probably add to this list, but emotions communicate to us. So if I'm, about to meet with somebody and I'm kind of having anxiety about it, I can ask myself, what is that anxiety about? Is this an unsafe situation, or is it more that it's just going to be maybe a difficult conversation and I'm kind of preparing for that? We want to kind of check the facts once we're tuning into our emotions and try to figure out what information they're giving us. And is that kind of helpful and accurate, or is it kind of getting in the way? And we'll talk about that more. Emotions help us communicate to people, right? And so, if my boss, we're sitting in my team meeting and my boss says, "Hey, Lindsay, we have this project. Can you take it on?" If I'm kind of like, and I like look down at my planner and I'm like, okay, like I think I can do it. When do you need it by? Versus like, yeah, absolutely. I'd be happy to take that on. I'm sort of saying the same thing. I'm agreeing to do the project, but I'm communicating to my boss, whether or not this is an effective way to communicate that, right? But I'm communicating to my boss that I'm maybe stressed, kind of overworked, feeling overwhelmed. Emotions also help to prepare us for action. I think somebody mentioned that. So, when I was getting ready for this presentation today, I was motivated to finish my slides and feel like I had been prepared, because showing up unprepared would have made me feel really anxious. Similarly, if I am walking down 3rd Street outside of our building here in San Francisco, and I start to walk out into the street and I'm not paying attention, and the Muni comes kind of roaring up the street, I'm going to jump back, right? I'm not going to wait and ask myself, should I get out of the way? What's happening? My emotions, my anxiety, my fear is going to help me get out of the way really quickly without having to think about it on a conscious level. I would say also thinking along the lines of culture, that a lot of this is culturally based as well, right? Like the value that we place on emotions, or not valuing emotions, or kind of valuing emotions in different ways, are highly culturally influenced. And we know that many of the young people that we work with may be living in multiple cultural contexts, where their families may have one view of emotions, their peers and providers and teachers may have other views of emotions. And so navigating that can be quite tricky for all of us, I would say, and particularly the young people that we work with. Okay, so most of this didactic today is about how to change emotion, but I want to point out that we don't always want to change emotion. That's not always our goal. And, having a high sense of well-being is not the absence of negative emotion. It's not kind of always being happy. That's not realistic. And I would argue that doesn't lead to a full life. And so sometimes we want to think about, if one of the young people we're taking care of is experiencing a difficult emotion, is that something that we want to help them change? Do they want to change it? And if not, we might consider validation instead. So an example might be, say somebody's parent has to go live away from the home for work for several months and they're missing their parent. I want to validate that. It makes so much sense that you're sad because you miss your mom. Now, if this is getting in their way, we might also want to help them engage in some behavior or thought change around that, and we'll get to that. But we certainly want to provide that validation piece to start. And we might, in some cases, leave it at that. There may be kind of nothing we can do, or nothing that's really appropriate to do to try to change the emotion. Okay, so I think we could probably debate like what clues us into knowing that we might want to change an emotion. This is sort of my view of it. Is one thing would be if it's getting in the way of what a child wants or needs to do, playing, being with friends, engaging in activities, going to school, doing their schoolwork, participating in chores at home, things like that. Those are all things that kids need to do and typically want to do some of those things. Or if an emotion doesn't fit the facts, say I'm working with a young person who's really fearful of dogs. Maybe they've had a scary experience with dogs and they're having difficulty kind of going outside at all because they're fearful that they're going to run into a dog. We'd want to help them work through that, because we don't want their world to get so small that they're kind of unable to be outside. Okay. It's hard to change emotions directly. I don't know if any of you have ever had success with saying like, oh, I shouldn't be feeling so anxious about this, or I shouldn't be feeling so angry about this. I've never been able to have that change my anger or my anxiety. If anybody has, please let me know. I would love to know how to do that. And so we want to use actions or thoughts as avenues to change emotions. Okay, so when we're looking at a situation, we're supporting a young person, we want to ask ourselves, what can be improved about this situation by action? That would be environmental or behavioral changes. And what by mental change or changing thoughts? Okay, so looking at this example, could you all again put in the chat? Thank you for participating that first time. Could you put in the chat, what are some things you're noticing that would be avenues for changing the feelings, right? So these would be behaviors that we could change, thoughts that we could change, environmental factors that we could change for this particular situation. And feel free to make up some details. I know they're not all fleshed out here. Change the environment. Yeah. We could maybe have a student, in the case of school, walk with us down the hallway, maybe even step outside and take a few breaths of fresh air and come back into the classroom environment. Absolutely, I love that. Going out for a walk, even though feeling depressed or not wanting to. You're referring to something that we call in our lingo behavioral activation, basically like doing things that help us because they're enjoyable or they give us a sense of accomplishment, even though we don't feel like it. Yeah, thoughts like, I don't usually fail math tests, I'll probably be okay. Great. Yeah, avoidance or staying home from school, or we could help them to be able to go to school despite that urge to avoid. Okay. So great thoughts there. And I took a stab at this. There's many ways to do this. There's no right or wrong answer here. But so things that we can change. So in the environment, sit in a calmer place in the classroom, giving a tangible support if possible. I think I often overlook how important these things can be, but if it's feasible in your environment, sometimes a drink of water, a snack, a 5-minute break for the young person to close their eyes and reset, that can really go a long way. We know that when we're not physically well, it's very hard for us to be emotionally well. Behaviorally, if there's urge to stay home from school, as Lauren was pointing out in the chat, we would want to work with the family to make a plan to get to school. We know that avoidance just increases over time. So once a kid starts to stay home from school, it becomes increasingly challenging to get back to school. Or a classroom behavior plan, like in the example of a kiddo who's being extra quiet in class, maybe setting a goal around, if that's ongoing, maybe setting a goal around speaking up once in a day in class and being rewarded for that in some way, even if it's just a verbal affirmation of their effort. And then finally, thoughts. So Evan put a good one in the chat. Some other examples would be helping the student to think through, I studied hard and I'll do my best. Even if I don't do well on this, I can try again next time. I'm going to be okay. The world isn't going to end. So there are some frameworks in thinking about this. So in terms of changing thought and that tool, there's what we call kind of common thinking traps, or ways that we as humans get stuck in unhelpful thoughts that are kind of similar patterns across humans. And many of us have sort of one or two of these traps that we have a tendency to fall into. So I'll let folks just read through this, and I'll just pick out a few that might often come up for young people. So one would be catastrophizing, or really blowing things out of proportion. So with this example, that might be like, I'm going to fail this math test, and then I'm going to fail all the other math tests, and then I'm going to fail 4th grade, and I'm never going to be able to go to middle school. Emotional reasoning. So that might be like, I'm feeling anxious about this test, so that must mean that I'm going to do poorly and I didn't study enough. I should have studied harder. I can't believe I did that. should statements. Sometimes people say like, don't should on yourself. This would be making yourself feel guilty, like, oh, like here I go again, feeling nervous about this math test. I shouldn't be feeling so nervous. Like, I don't know why I always do this to myself. Ways to kind of approach this with kids. These are some sample questions. So if you're sitting down with a student or a young person that you work with, you might say to them, say they're saying to you, I'm going to fail this test. Like, there's just no way I'm going to do well. I'm going to fail. I can't believe this. I can't take this test. There's no way I can do it. These are some questions that you can ask them to help try to loosen up their thoughts a little bit. And basically you're trying to elicit from them kind of alternate thoughts or more helpful thoughts. And sometimes I'll label that, like, is there a more helpful way that you could talk to yourself about this? And it's also okay to just offer ideas and examples if they can't think of anything, but usually it's most effective if they're able to come up with something themselves. An important piece with thought interventions is if somebody is experiencing a difficult emotion around an experience of oppression, including racism or other forms of oppression, we want to not jump too quickly and maybe not jump at all to thought intervention. We want to provide validation and let them know that we hear their experience and we believe them. Not that we think that they're having kind of like a distorted view of what's going on. Okay, so shifting to other actions and thinking about behavior change, what can people do differently? The heaviest hitter here is such a heavy hitter that we're going to have a full echo on it that Evan is going to be doing soon. So stay tuned for learning more about opposite action. But basically that's sort of doing the opposite of what the emotion is telling us to do. So if the emotion is telling, my anxiety is telling me I should stay home from school, opposite action would tell me to go to school. Similarly, if I'm worried about, having a social interaction, and so I'm tempted to stay home, opposite action would tell me to show up, stay for an hour, kind of whatever parameter I set for myself, and then do my best and see how it goes. We can also help students to use tools like distraction, relaxation, and grounding. These are kind of your general tools for dealing with difficult emotions when we want to change them, and they absolutely apply in this situation. And finally, environmental change. We already talked about many of these examples, but thinking about things we may be able to do to change the context that the student is in. Some contexts may not be changeable, but some of it may be, and that can be another area of intervention. The nice thing about this triangle is we can intervene in any one of these three areas, thoughts, behaviors, or environment, in order to have potential emotional change. We don't need to be doing all three of those things, although you certainly can. Takeaways. Emotions serve a purpose. You all knew that really well. I like the responses that folks put in the chat. Thank you. And when we want to change an emotion, we have a number of tools to do that using this framework. So thanks so much for your attention. Looking forward to our discussion.